Welcome back, friends, and all of the followers of Dr. Mlelwa Lecturers channel. In the previous session, I told you that we start discussing one course after another, and I told you we start discussing one session after another in every course of the basic sciences in the second year of Doctor of Medicine. Now, courses are pathology, parasitology, pamoja na microbiology and immunology. They can be shared, they can be learned by the MD2 and DDS2 students. So for today, nitaanza na pathology, and then other days nitaendelea upload sessions in other courses and in the other sessions of this course. So tuanze na pathology. Kwanza tuanze by discussing the meaning of pathology, or what does it mean tunaposema pathology. And this session will be discussing regarding the introduction to pathology. Kwa tutakuwa tunaona introduction ya pathology. Pathology ni nini? Ukisikia tu pathology from nowhere, ni kitu gani chi pathology? Pathology, what is pathology? Pathology comes from two Greek words. Pathos means disease and logos means study. Pathos, disease, and logos, study. So it is the scientific study of disease into its nature, the nature of the disease, the cause of the disease, the mechanism by which a disease tends to kill an organism or kill the cells, and the effects of the disease. Kwa hiyo kwenye pathology tunasoma kuhusu diseases, the nature of different diseases, their causes, their mechanism, and then the effects. What are the effects? So we shall be discussing a lot of diseases and all over the systems of the body. We're going to discuss disease mbalimbali. That is all about pathology. So it's essential for all will be doctors as well as the general practitioner and the specialist. Hii ni ya muhimu kwa watu wote, kuanzia wale ambao wanataka kuwa doctors, general practitioner au kuwa specialist. Kwa nini? Kwa sababu even a specialist ana specialize a certain field, lakini bado it's better kujua the relationship kati ya ile field ana specialize na field nyingine, ili kwamba kama anafanya surgery of one part, awe anajua pia kwamba this surgery I can injure certain nerve ambayo inaweza kapelekea effect or a certain pathological effect in another part of an organism. Also, it deals with the treatment of diseases and prevention. All depends on knowing the underlying pathology in the patient. Actually, pathology hatusomi treatment. Treatment ya disease tunaenda kusoma kwenye pharmacology. Lakini bado tunavyoenda kufanya treatment ya disease kwenye pharmacology, tunahitaji kuwa na underlying knowledge of pathology, kwamba tunatengeneza medication fulani ya kumua bakteria. Now tunatakiwa tujue, je, huyu bakteria ana athiri vipi mwili wa mtu? Tunatakiwa tujue huyu virus anaingiaje kwenye mwili wa mtu. Je, hii dawa itamfikiaje? Unaona, ili kuweza kujua vitu vyote we must have the knowledge of pathology. Na ndio maana even watu wanaosoma BPharm pia pathology wanaisoma. Unaona, for the medical students, pathology is the vital bridge between initial learning phase of preclinical science and the final phase of clinical subjects. In your first year, tulikuwa nasoma vitu kama anatomy, tulikuwa nasoma vitu kama physiology, tumesoma clinical physiology, unaona. Hasa unaposoma anatomy unasoma muundo wa kawaida wa mwili, unaona. Tunapokuja kwenye pathology, tunachambua vile vile vya kwenye anatomy, unaona. In the first year tulisoma labda histology of the lungs, au tulisoma labda gross anatomy of the lungs. Tukija kwenye pathology now, tunakuja kuangalia kwamba je, vile tulivyoviona kwenye gross anatomy, vikiwa vina disease fulani, how their appearance tend to change, unaona. Na ndio maana kuna kitu tunakiita anatomical pathology. Anatomical pathology maana yake tuna link the knowledge of our basic science ya first year, which is anatomy, then tuna link na different diseases which can occur in human beings, unaona. So katika pathology tunakuwa tunajua kwamba mtu akiwa kawaida anakuaje, and then akishapata disease fulani clinical phase inakuaje. So this is the major bridge. Hii ni daraja ambayo ina link kati ya preclinical science ile ambayo tulisoma in first year and second year. This is the preclinical, before clinic, and then with the final phase of clinical subject, which is 3rd year, the 4th year, and the 5th year. When you are going to clinic, you will see a lot of things which we discuss in pathology, or a lot of things which you learned in other courses in your 1st year. So, what is a disease? Tumesema pathology is the study of diseases. Now, what is the disease? Simply, disease is the opposition of health. Is the opposition of health, or it is a state of discomfort to the body. This is discomfort. So, a person doesn't feel comfortable, as if there is something wrong in the body. That is disease. This is an abnormal variation in structure and or function of the body. Kunaweza kuwa kuna a variation, kunaweza kuwa kuna kitu kimeshindwa kufanya kazi vizuri, au kuna structure haiko vizuri. It can be abnormal variation in structure or function of the body. Unaona, abnormal variation of structure or function of the body. Now, tumesema disease is the opposite of health. Yani kinyume cha health. Is the opposite of health. Health ni kuwa na afya. Opposite ya health in disease. Now, what is health? What is health? Health, it has different perceptions to be defined. Unaona, different people, they define health in different perceptions. So, perceptions of health and disease vary between individual and professional viewpoints. Kwa hiyo watu mbalimbali pamoja na professional mbalimbali wanaangalia health pamoja na disease in different ways. Some define health as merely absence of signs or symptoms of disease. Some. Hatujasema this is the universal definition of health, lakini tumesema some define health as merely the absence of sign or symptoms of disease. Some people, they define health in this way. And sometimes people believe to be ill but have no measurable signs or symptoms of disease. So unaweza kumkuta mtu ambaye yeye anaamini kuwa yuko ill, anaumwa, lakini hana dalili yoyote ya ugonjwa. Yeye anaamini kuwa yuko ill. Anaamini yuko ill, yani ni kama na feel as if I'm not comfortable. But tukienda kupima tunakuta hana ugonjwa wote. So actually haijulikani either ni spiritual factors or not. Conversely, there are people who believe themselves to be well and have no symptoms. Yet, on examination, they are found with a disease. Kuna baadhi ya watu ambao unaweza kumkuta akasema mimi ni mzima, lakini tukienda ku-examine blood, tukafanya histopathology au tukafanya cytopathology, tunagundua the symptoms of disease or the organisms which cause the disease. So, the definitions of health and disease, they tend to differ from people to people. Some people, they believe that health, it is simply the condition of having no symptoms of disease. And some people, wanaweza kuwa na symptoms of disease, but when we go to cytopathology and histopathology, we don't recognize any disease. Unaona bwana? But WHO tend to define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. This is the WHO definition of health. So, actually, when you be asked maybe what is health, you can't be asked what is health, but sometimes it can happen in the multiple choice questions that what is the definition of health according to WHO? It is the state of complete physical, then mental and social well-being, and not merely the absence of disease or infirmity. So sometimes unaweza ukawa you don't have disease, but if you are not complete physical, mental, and social well-being, that means you are not healthier. You are not healthier. So the opposite of this, that means any incomplete physical, mental, or social well-being will lead to opposite of the term health, which will be a disease. So a common term confused with the disease is illness. Most often, for most of students who are wana mix kati ya disease na illness. What is the disease and what is illness? While disease suggests an entity with a cause, illness is the subjective reaction of an individual to disease. Kwa hiyo disease huwa ni kitu fulani ambacho kina kisababishi. Unaona? It suggests an entity with a cause. Kitu kinakuwa kinasababishwa. Malaria is caused by the presence of plasmodium in the red blood cell and the bursting of those plasmodium and invading other red blood cells. The bursting of the red blood cell invaded by plasmodium and then the invading of other red blood cell. Unaona bwana? So disease lazima iwe na cause, lakini illness ni nini? Illness ni zile reactions now. Tayari plasmodium ameshaingia kwenye mwili. Nini kinatokea kwenye mwili? Mtu ana feel joint zina maumivu, ana feel yuko weak. That is illness. So illness is the subjective reaction of an individual to disease. What an individual feels when the cause of disease enter the body. Unaona? Kwa illness ni kile ambacho kinakuwa kinatokea kwenye mwili baada ya kinachosababisha ugonjwa kuingia ndani ya mwili. Now usually illness unaweza kaiona kupitia symptoms and physical signs. And there is difference between the symptoms and the physical sign. Most of people, they don't know. Symptoms, these are the complaints of a patient. Kwamba what a patient tend to complain. Umemkuta mgonjwa odini, umemuuliza wewe nini kilichokupeleka, nini kilichokuleta odini? What is your chief complaint? Nini kilichokuleta odini? Kilichonileta odini ni bandama, upande huu wa bandama kunauma. Yani yeye hajui ni nini, lakini tu anasema upande huu kuna maumivu. That is symptom. Ile pain, unaona, labda hypochondriac pain, ile pain ndio ambayo tunaita symptom. But the physical sign, they are listed by physician. Signs haziwezi kujulikana na mgonjwa. Sign anayejua ni daktari. So daktari ndiye ambaye labda anapalpate, anakuja kusema okay, yani mgonjwa aliona tu sign, aliona dalili za maumivu. Daktari ndio ambaye anapalpate, anasema okay, there is splenomegaly. Unaona, anapalpate. That is the sign. Splenomegaly is the sign. But the symptom ilikuwa labda ni pain. Unaona? So mgonjwa aweza akajua pain, mgonjwa anajua symptom. Unaona bwana? So the study of disease is done in pathology. Katika pathology tunasoma nini? Tunasoma disease. Nature disease, jinsi ambavyo ina develop, cause the disease. Lakini utakapofika wodini sasa in the third year utakuwa unasoma illness. Kwa sababu utakapofika wodini hatakuwa unasoma tena jinsi gani ambavyo inflammation inatokea. Utakapofika wodini utakutana na mgonjwa ambaye anakuambia ninahisi maumivu upande huu. That means ile inflammation tulikuwa tunaidiscuss huku, yeye anaenda kukuambia illness. Huku tulikuwa na discuss disease, how a disease is caused. Lakini ukienda wodini unaenda kuona illness, yani zile symptoms sasa, complaints of a patient, unaona, and the physical signs which can be found by the physician, unaenda kuziona wodini sasa. So there are some of the terminologies used in pathology. Kuna baadhi ya terminology ambazo zinatumika kwenye pathology. Kwanza ni patient. Who is the patient? Patient is the person affected by disease. Kwa mtu ambaye anakuwa affected by disease anaitwa patient. Unaona, lakini pia tuna terminology ya lesion. Lesions. Lesion, these are the characteristic changes in the tissue and the cells produced by disease. Unaona, kwamba a certain cells of body, let's say the lung cell, zimeingiliwa na virus. Sasa akishaingia ile virus anaweza kasababisha madhara fulani. Let's say anazifanya zile cells ziwe solid, au let's say anazifanya zile cells ziweze kustrain sana. Let's say anazifanya zile cells ziweze kuwa na muonekano fulani, appearance fulani. Ile ndo naita lesions. So lesion is the characteristic changes in the tissue and the cells produced by disease. Unaona bwana? Lesion ndicho kitu ambacho kinakuwa kinatufanya tujue okay, this tissue is affected by this kind of organism. Kwa nini? Kwa sababu tunapokuwa tuna examine ile tissue, tunakuwa tunaona lesion, tunaona kule kuharibiwa. Different organism, they tend to cause lesions of different kinds. Unaona bwana? Bacteria, viruses of different categories, they cause different categories of lesions. Unaona? Kwa hiyo the nature of the lesion tells us the nature of the organism which caused the disease. Nature ile lesion itakavyokuwa itatuambia organism ambayo imecause disease. Kwa mfano, tenda kusoma hata kwenye parasitology, amoeba tu wa kawaida, entamoeba histolytica, anasababisha lesion ambayo tunaita ni flask shaped ulcer. Unaona, that is a lesion, yani ameharibu utumbo kutengeneza flask shaped ulcer. Unaona? So the flask shaped ulcer is the unique characteristics of entamoeba histolytica, how it causes a lesion. Then from there we have another terminology which is pathological changes or morphology. This is the examination of diseased tissue, kwamba tuna examine diseased tissue, tunaangalia ile tissue ambayo imepata disease. Hiyo tunaita lesion. Lesion ni kitu ambacho kinakuwa ni yani inakuwa ni kidonda fulani kinachoonekana ni kikubwa, tunaita lesions. Unaona? Lakini pathological changes, some of them they can be microscopic. We can observe the cells by microscope and then we can observe the pathological changes. So the lesion is simply the physical appearance of the tissue, how it is distracted. And the pathological changes also, they are the one which lead to lesion. So the pathological changes, some of them they can be observed by the naked eyes, or they can be the growth changes, and some of them they can be microscopic examination of the tissue. Kama ambavyo tutakavyoenda huko mbele tutaona different pathological changes zinazotokea kwenye different diseases. So another terminology is etiology. What is etiology? Etiology is the cause of a disease. Kwamba nini kilichosababisha disease is what we call as etiology. So when you are talking of the etiology of any condition of the body, we are talking of the disease. What causes the variation from normal? What is the cause? The causal factor responsible for the lesion. What is the causal factor responsible for the lesion is the etiology. Then pathogenesis is the mechanism by which lesions are produced. Pathogenesis. That means, let's say entamoeba histolytica tayari ameshafika kwenye small intestine. Now, by what mechanism this entamoeba histolytica lead to the development of the flask-shaped ulcer? This is what we call the pathogenesis. So pathogenesis is the mechanism by which an organism which has invaded a human being, unaona bwana, yani yule, let's say it's the parasite or it's a bacteria or it's a virus, how this virus brings about the lesion, how this parasite brings about the lesion, or how this bacteria brings about the lesion, that is the pathogenesis. So it is the mechanism by which this organism tend to distract the host. It is the pathogenesis. And then we have the functional implications of the lesion felt by the patient. Functional implications, yani kwamba baada ya flask shaped ulcer, manake huyu mtu atakuwa na amoebic dysentery ambayo atakuwa analisha damu. Kwa nini? Kwa sababu flask shaped ulcer manake ata injure the blood vessels, and then zile blood vessels zitaanza kufanya nini? Hemorrhage, kwa sababu blood itakuwa inatoka. So katika functional implications of the lesion felt by the patients, tutakuwa tuna symptoms pamoja na physical signs. Kama nilivyokuambia pale mwanzoni kwamba there is the difference between the symptoms and the physical signs, as I told you previously. So the clinical significance of morphological and functional changes plus other investigations. Tukisha ona sasa kwamba tumeona morphological changes, kwamba nini kimeharibika pale, tumefanya microscopic, tumefanya gross, tumeona nini kilichoharibika, tumeangalia functional changes, kwamba baada ya hichi kitu, je, which part of the body imefail kufanya kazi, tumelink, unaona, with our knowledge of anatomy and physiology, and then plus other investigation. Finally we came up with what is wrong, nini, kuna shida gani kwenye mwili wa huyu mtu, that is diagnosis. So diagnosis is to know what is wrong. Let's say a patient has malaria, so we have diagnosed the patient with malaria, tumemkuta mgonjwa na malaria, that is diagnosis. So diagnosis is to know what is wrong in the body of this organism. What is wrong? It is diagnosis. And what is going to happen? It is the prognosis. Kwamba tumeshamkuta na malaria, lakini je, huyu mgonjwa ataendeleaje? Either tukimpa dawa au tusipompa ataendeleaje? That is prognosis. Kwa prognosis ni maendeleo baada ya kujua ule ugonjwa sasa. Kama tukimpa dawa, prognosis inaweza kawa akapona. Lakini tusipompa dawa, prognosis inaweza kapelekea to other effects and finally death. So what is going to happen is called prognosis. What is wrong? Kuinvestigate na kujua kile kitu is diagnosis. What can be done about it? It is treatment. Je, tumfanyeje sasa? Tumfanyeje huyu mgonjwa? That is treatment. And what can be done to avoid disease complications and spread. To avoid the disease complications and spread. Nini kifanyike ili kuweza kuavoid the disease complications and spread? This is what you call the prevention. Unaona? So in pathology actually we'll be dealing with knowing what the cause and the mechanism of pathogenesis of the disease, and finally a bit of treatment. But actually the prevention of diseases, we must study this in epidemiology. The treatment, we must study this in pharmacology. The prognosis, we can study this in pathology, and even diagnosis, we are studying this in pathology. Now let's discuss a little bit about the evolution of pathology. Evolution of pathology. Kwamba pathology ilianzia wapi? The concept of disease is old as life itself. Disease ilianzia muda mrefu sana, yani kama vile ambavyo watu walianza kuishi. So from the eras of Adam and Eva, the concept of disease was there. Actually, for Adam and Eva, there was no disease before sin. Before sin, that is real. Before sin, hakukuwa na disease kabisa, completely. And this is for the case if you believe that we made by God. But if you believe in the science and evolutions, it will be difficult for you to understand me. Now, before sin, kulikuwa hakuna disease kabisa. As you can see this point, from religious beliefs to rational approach, unaona, a disease is an outcome of cause or evil eyes of spirits, unaona. This was the first interpretation of the disease, unaona, and this, I can say it is the true definition of the disease according to Quran and according to the Bible. And even the books of science, they are going against this sentence, but it is very true. A disease is an outcome of cause or evil eyes of spirits. Ugonjwa ni matokeo ya makosa. That's the reality. If you don't believe, just ask yourself why Adam lived 900 years. And then today we don't live 900 years. The reason behind is because of the increase in the evils in the world. Now, towards them of priests through prayers and sacrifices used to invoke supernatural powers to please the gods. Unaona? So, mwanzoni ilikuwa tu ni priest, mapadre, watu wa Mungu wanaomba through prayers, magonjwa yanatoka. And even nowadays, there are some people, including me, unaona, I don't use some kinds of medications which are used by other people. Why? It's because of the prayers life I live. But I don't say that medication is sin. It's not sin, it's just good, and that's why I am teaching pathology. So, kilichopo ni kwamba, by that time, ilikuwa ni people wanapiga prayers, zile prayers zinaondoa ugonjwa. And even nowadays, it is possible. So the link between medicine and the religious became so firmly established worldwide. So later, kulionekana kuna muunganiko kati ya medicine pamoja na science. Unaona bwana? The Greeks had Asclepius, the god of healing. Kwa hawa Wagiriki walikuwa na huyu Asclepius. Huyu waliamini yeye ni Mungu anayeponya. God. Actually, this is not God of heaven, because unaona imeandikwa imeanza na herufi ndogo. Huyu aliamini yeye ni Mungu anayeponya. Later on came the concept of religious belief was replaced by philosophical and rational approach to disease by methods of observation. So later, ile concept iliyokuwa inajulikana regarding the disease ikawa replaced, unaona, ikawa replaced with a philosophical and rational approach to disease by methods of observation, unaona. So hii ilikuja later baadaye sana, unaona. The important people in medical history, and these are also important even in the evolution of pathology, unaona, kwa sababu nimekwambia anatomy at the great link with the pathology, na pia ina great link with medicine itself. The first person is Hippocrates, ambaye hata kwenye anatomy tulimuona. This is the father of medicine. He lived 460 years to 377 years before Christ. He stressed the studies of patients' symptoms. So alikuwa ni mtu ambaye alipambana sana. He fighted a lot to study about the symptoms of patients, kwamba mtu akiwa na dalili hii ina maana gani, akiwa na dalili hii ina maana gani, akiwa na dalili hii ina maana gani, akiwa na dalili hii. So ali stress sana ku study about the patient symptoms. Then he described the methods of diagnosis, njia za kuweza kudiagnose magonjwa, and he wrote what we call the Hippocratic Oath. This is the ethical conduct for doctors. All doctors, they must take the Hippocratic Oath, ambayo inakuwa ina kiapo. Hiki ni kiapo cha madaktari wote ili kuweza kumwapisha huyo daktari afanye kazi vizuri. However, not all doctors they are working under this oath, but this is the oath for all doctors. And then from there we have another person, which is Cornelius Celsus. Cornelius Celsus. He described the 4 cardinal signs of inflammation. We shall discuss these later. The cardinal signs of inflammation, they were described by the Cornelius Celsus. Sometimes in the multiple choice questions you can be asked, who was the first person to describe over the 4 cardinal signs of inflammation, and then you can be given the names. And then we have the Claudius Galen. Claudius Galen, huyo alisema kwamba illness resulted from imbalance between 4 body fluids, which are blood, lymph, black bile and biliary secretions. Alisema hivyo kwamba illness inatokana na imbalance between 4 body fluids ambazo ni blood, lymph, black bile and biliary secretions. That's according to Claudius Galen. Kulikuwa kuna baadhi ya disadvantage regarding the ideas of disease ambazo zilikuwa zinatumika. There are some of the setbacks. Unaona, kwanza ni widespread and devastating epidemics reversed the process of rational thinking again. Unaona, kwa hiyo namna ya magonjwa kusambaa sana ilifanya sasa waanze kufikiria zaidi kuhusu disease, kwamba what's behind this. Yani ile mwanzoni ilikuwa najua tu okay, sometimes maybe tumefanya makosa tumefanya, but later they started thinking more regarding what is the cause of the disease. And then the supernatural concepts and the divine punishment for sins dominated again. Unaona bwana, supernatural concepts sometimes ilikuwa inaonekana supernatural concept, yani ile vision ya watu kuangalia sana kwamba kuna uwezo na nguvu isiyojulikana iliyokotoka, the supernatural power from God. Unaona, uwezo na nguvu isiyojulikana ilikotoka. Hii inaweza kusababisha majanga kwa watu. Unaona, inaweza kusababisha majanga na ikaua watu hata wengi. Unaona, and then the beliefs was that life was due to influence of vital substances under the control of soul. Unaona, watu waliamini kwamba maisha ni msukumo wa vitu fulani ambavyo vinakuwa controlled na soul, yani na roho ya mtu na nafsi ya mtu. Hizi ni baadhi ya disadvantage. Lakini later dissection of human body was strictly forbidden, and that would mean heart of the soul. Dissection ya human body ilikuwa imezuiliwa kabisa kudissect maiti, as how we are doing in first year, ilikuwa imezuiliwa kabisa. Lakini baadaye akaja mtu akaanza kufanya dissection. Unaona, the emergence of anatomy and the morbid anatomy. Emergence of anatomy and the morbid anatomy. This was the revival time of learning. Unaona, au tunaita Renaissance period. Unaona, began in Italy and spread to the rest of the Europe in 19th century. Since there was freedom of thought, emphasis on a philosophical and a rationalistic attitude strengthened. Unaona, kwa hiyo kabla haijaanza emergence ya anatomy na morbid anatomy ya kudissect cadavers, kudissect maiti, manake imani kubwa ilikuwa tu ni kuamini kwamba everything is because kuna supernatural power. Actually, everything is controlled by that supernatural power. So whether you believe or you don't believe, everything is controlled by that supernatural power. Whether you know or you don't know, the last situations, even doctors will reach, we say that just go to home, stay there, and then just wait for your final day. But sometimes we are wondering that God can heal that person, and then we are start saying that it is the supernatural power which we don't know what the origin of it, which you call it God, which control all the things in our life. Unaona? So the development of anatomy, unaona, dissection of the human body started by the Vesalius Gabriel, Vesalius Gabriel Fallopius, ambaye alidescribe the human oviduct ambayo naita fallopian tubes. It's because of this name Vesalius Gabriel Fallopius. Unaona, I described the structure of human oviduct. Unaona, Fabricius discovered lymphoid tissue in intestine of birds. Kwa hiyo this is another person ambaye described the lymphoid tissue in the intestine of birds. Baada ya kuanza nini? A dissection of human cadavers. Unaona, beginning of the study of morbid anatomy by the Giovanni Morgani, unaona, laid down the foundation of clinical pathological methodology in the study of disease. Unaona, baada ya kuanza ile anatomy ya dissect cadavers, ndipo ambapo ilikuja kufata knowledge sasa ya kwanza kuangalia the clinical pathological methodology in the study of disease, kwamba what the causative agent of the disease, what have caused a different illness and different symptoms of the disease. Unaona bwana, kwa they performed 700 postmortems. 700 postmortems manake they took 700 dead bodies and then they investigated them to know what's wrong with them, what is the causative agent of the death in these 700 bodies of human being. Unaona, now we have already discussed regarding the history of pathology na origin yake ilikuwaje na mwanzoni walikuwa na nini regarding the disease. Let's discuss regarding the subdivisions of pathology. Human pathology is divided into general pathology, which is studies things generally. Actually tunasoma vitu bila kulifaa, without referring to specific system. Tukisoma inflammation, we are discussing about the mechanism of inflammation in all body organs. We don't specify a certain system kwamba how the inflammation takes place in the lungs. That is the general pathology, and it designed to show fundamental reactions to disturbances in the body. Unaona, na module 1 of pathology tutakuwa nasoma general pathology, and then from there we have the systemic pathology about tutakuwa nasoma by system. We are studying diseases pertaining to specific organ and body system. Let's say digestive system, respiratory system, central nervous system. Hii ni module ya 3 kwenye pathology. Module ya kwanza ni general pathology. Module ya pili ni hematology, nasoma kuhusu blood. Module ya 3 ni systemic pathology, na ya 4 pia. Number 3 is the clinical pathology. Clinical pathology na include both the general and the systemic. The knowledge of general pathology and the knowledge of systemic pathology, they are both collected together to make us to have a lot of knowledge in clinical pathology. So it deals with the problems of patients and the bedsides, at the bedside, kwamba huyu mgonjwa ameshafika sasa wodini. What the problem with this patient? Tunaangalia symptoms zake, tunaangalia signs ambazo tuzi investigate, then tunataka kujua what the cause of the disease of this patient. Includes the study of the laboratory tests used for the diagnosis and management of the patient. Actually, here we are studying the basic science. Hata kama tunasoma some basics of diagnosis, but not much as in the clinical medicine ambako unasoma hizo basics of diagnosis vizuri kabisa. So with the advancement of diagnostic tools, the specialty of pathology has come to include the following subspecialties. Unaona, baada ya pathology kuendelea sana, inaonekana iwe included in some of the subspecialties. Unaona, we have the surgical pathology. This deal with the surgical pathology ina deal na kupasua. Unaona, tunafanya surgery ya vitu mbalimbali na kuweza kujua structure yake, au kuweza kujua vitu mbalimbali, kuweza kujua disease. Yani unakuta ile ambayo mtu anaenda hospitali anamwambia daktari kwamba mimi naumwa kitu fulani. Watu wa surgery wao nasema watu wa surgery hawajui. Yani watu wa surgery they don't know a lot of things. What they know is just to dissect. So wewe ukienda kwa watu wa surgery ukiambia I have the problem 1 2 3, what they are telling you ni kwamba okay, ngoja tupasue tuone what is inside, kwamba ngoja tu dissect tuone nini kiko ndani. That is surgical pathology. And then we have forensic pathology and autopsy. Forensic pathology nasoma zile kesi za mauaji, imetokea kesi ya mauaji ya kitu fulani, ile ndio forensic pathology. And then cytopathology sometimes kuna kitu kinaitwa histopathology ambavyo huwa vinawekwa pamoja. Cytology nasoma kuhusu cell, kwamba hii cell ikiwa kawaida huwa inakuwa hivi, sasa hivi ina appearance, what's wrong with this cell, it is cytopathology. Tukiwa nasoma kuhusu tissue, it is histopathology. Unaona, histopathology, unaona. Lakini pia kuna hematology and blood transfusion, ambayo nilikwambia ni module ya pili. Hematology and blood transfusion, hii tunasoma kuhusu diseases of blood, sickle cell anemia, thalassemia na vitu kama hivyo hapo, diseases of blood na blood transfusion. Then you see the chemical pathology. Chemical pathology tunasoma this is the clinical chemistry, the metabolic disturbances of disease, kwamba labda kisukari kinapelekea sukari iongezeke, insulin ionekane kwa level fulani, the chemistry or the chemical changes of different things in the body during disease. Unaona, ndio naita chemical pathology. Lakini pia tuna microbiology and medical immunology, na tuna parasitology and medical entomology. Hii microbiology inasoma kivyake, parasitology inasomwa kivyake. Unaona, zinasomwa kama course zinazojitegemea. Now, why do we learn pathology? Not all of the medical students, they are not going to be pathologists. Now a student can ask him or herself, why do I learn pathology now if I'm not going to be pathologist? Actually, pathologist ni mtu ambaye is the specialist. Let's say ana masters au ana PhD of dealing with the diseases. Pathologist, huyo ni mtu anaye deal na disease. Akipelekea tu slide fulani akiangalia anajua this is sickle cell anemia. Kwa pathologist ni mtu ambaye anakuwa specialize kwenye disease tu. Unaona, hasa most of the medical students, they are not going to be pathologists. Why is it important for you to learn pathology? And why should the medical curriculum include a course in pathology for undergraduate? Pathology provides a clear account on the cause, and the pathological changes, which provide a logical explanation for the symptoms and signs and biochemical changes. Kwa hiyo inakupa knowledge ya cause pamoja na changes zitakazotokea. Cause ya disease na pathological changes zitakazotokea, ambayo hiyo itakupa uweze kuwa na explanation ya nini, ya symptom. Ile cause na pathological changes zitakazotokea zitakufanya ujue symptom gani zitatokea, sawa? Zitakufanya ujue signs gani mgonjwa yani symptom gani mgonjwa complain, sign gani utaziona, na biological changes gani utazikuta you expect to see in this patient. Unaona, na ndio maana tukiona level fulani ya glucose, level fulani ya hormone fulani, tunakuwa tayari najua this is a certain disease. Why? It's because tayari we have a prior knowledge of pathology. So how to learn pathology? There are different ways to learn pathology. Pathology is no exception to the general rule that learning is dependent on the student's own effort. Unaona? Kwa hiyo lazima unajua kwamba pathology depends on the own effort. Hivyo vitu lazima unavijua. Pathology kuweka tu effort fulani ya kusikiliza vizuri lecture anayofundisha, kusikiliza instructions zake, basi unaweza tu kuperform vizuri. Kwanza kuna lecturers, kuna small group discussion, tuna demonstration the practical, tuna clinical pathology conferences na autopsy ambao tuna investigate different tissues. This marks the end of our discussion regarding the introduction to pathology, unless we meet in the coming session when we will be discussing different things regarding pathology. So in the second session, you'll also be together with me when we'll be continuing to discuss regarding pathology. Thank you, and later I wish you nice studies. Don't forget to invite your fellow students to look this channel and to see these sessions, which will help them to memorize different concepts in pathology. Thank you, and later I wish you nice studies.